Hi, dear followers of Biohacking Congress. Julia Smila is here. Today, my live with Jeffrey D. Gross, founder and medical director at ReCELLebrate. I feel it's going to be a very interesting conversation. Stay with us to learn how to optimize and activate your own stem cell health. So I am inviting Jeffrey. Thanks for joining. About stem cell therapy. I think you all know that stem cell therapy has a potential to regenerate and activate your own abilities, health, and regenerate almost all organs and tissues which you can think about. Right, Jeffrey?
Good morning. Thank you for having me on Instagram Live, my favorite show.
Yeah, I agree with you. It's all live conversation, and sometimes unpredictable because some algorithms changes. First of all, thank you for being our partner at upcoming Biohacking Congress in Austin on February 4th and 5th. I'm looking forward to meet you in person, and I am very curious and interested to learn more from your lecture, which you are going to give at Biohacking Congress on the main stage. Here is some intrigue about stem cell therapy, because as far as I know, for many people, they think that it's reserved for athletes, famous people, and it's pretty expensive, from $5,000 to $50,000 per one treatment. But of course, it is powerful. It is powerful, as I said. It has potential to regenerate tissues and cells, right, and organs in our body. So I'm looking forward to learn more from you because you are a great expert in this industry. Tell us more what we can do with stem cell therapy, and what exactly do you offer at your company, ReCELLebrate?
Thank you so much. I'm very much also looking forward to coming to Austin in just over 4 weeks from now for the Biohacking Congress event. We're preparing a really informative talk on the latest in cartilage regeneration for the spine, for joints, although regenerative medicine, including stem cells, can do so much more because the very pathways that we are activating in our bodies are youthful pathways, and those youthful pathways can help slow or stop, or even in some cases reverse degenerative disease formation on the cellular level. So anything that slows or removes chronic inflammation on a cellular level is an anti-aging endeavor. So and that's really the down and dirty goal of any treatment we do, whether it's here at ReCELLebrate. The anti-aging services start with lifestyle changes, epigenetic modifications.
I like your statement. So together with some treatment, you propose and suggest lifestyle changes to support all pillars for longevity, I believe, including diet, rest, exercise, and supplementation, right, stress reduction. It's great. So you provide consultations on lifestyle changes for each client,
yeah,
together with therapy.
Everyone's different, and I will make the jump that the people attending the Biohacking Congress event and the people that follow and are biohackers like you are and I am have already made a lot of those changes. But we can always up our supplement game. That was my New Year's resolution, is one of them, to do better. This is my daily stack of supplements, and I'm adding to that because there are new things all the time that we learn about what our food supply isn't giving us, so we have to supplement that. So we start with supplements. We start with sleep, breathing, a type of exercise, because we want to be efficient about it. You can over-exercise. You could exercise but it not be effective. We talk about stress and breathing and all kinds of things. And then we take that to further steps, deeper biohacking, rapamycin, rapalogs, acarbose, things like this, hormone replacement. And then the third bucket, the third step would be regenerative medicine, whether it's preventative, whether it's spot treatment. And really my talk is more about spot treatment at the Biohacking Congress. We're going to talk about, you know, what is being done, what we can do, and what we are doing for regeneration of cartilage in our body. Because if we can help ourselves live healthier, live longer, improve our health span, but our joints are worn down, we're not going to be very happy. We're going to have pain, we're going to have limited function, limited mobility. So if we're going to live to be 130, 140, we darn well better take care of the mechanics, change our oil, if you will. So that's where the joint regeneration comes in. And we have some really great experience, and there's some wonderful science backing this up, and how to stimulate and activate stem cells in your own body to help improve the cartilage health. And we have MRIs of people before and after treatment, separated by at least 12 months, where we actually show cartilage that is being restored. So this is very exciting. Our bodies have had this all along. We're just giving it a little help.
Could you please tell me more about the process in ReCELLebrate? So you meet client firstly, what do you do firstly? Then how long time it takes to prepare the patient for the treatment itself? And how long the recovery after the treatment? Could you please explain step by step?
Yes.
And timing for this?
No, it's a great question. Well, we like to meet people through televideo. Most of our patients come from all over the country, and even some internationally.
Where are you located?
Yeah, so my main clinic is in Henderson, Nevada, which is a suburb of Las Vegas, Nevada. And it's, you know, easy to get to, big airport. I also have an office in Newport Beach, California, but most of the ReCELLebrate and regenerative medicine offerings happen in the Las Vegas office. That's just where we're set up to start this. We may expand, we're looking at that. But in the meantime, we start our interactions by a simple video call. Because many patients may not be candidates or may not be ready, or we don't know exactly what we need to do. So we need to start finding that out. Some patients need an MRI. Sometimes their MRI they had somewhere else is not adequate. We have them send the MRI, then we do a Zoom call, we pop the MRI up on the computer screen, we do a share screen, we go over the images, we correlate it to the pain and symptoms, we talk about someone's health goals, and we put together some options, and then we discuss the pros and cons, and of course we give the full informed consent because of the FDA status of these things. And then if it's something that the client wants to do, then we arrange for the client to come visit us. And most of our procedures are either IV or injected. And sometimes the injections for the spine and for joints, the best results come from injecting the bone just adjacent to the joint. Because you may, Julia, you may know this, but for all the listeners, the cartilage in our joints, in our knee and in our discs and our spine actually arise, those proteins arise from the cells in the edges of the bone just adjacent to the joints. So the stem cells that give nutrients and you know, information to produce more cartilage type proteins are existing in the bone. So we treat the bone, and this is following, this, I didn't design this, this is following the strategy, successful strategy of Dr. Hernago out of France. And
how long that was? How long that experience was? How long that doctor did the treatments? And is there some researches? Because what I found during my research, many information that the result is not always that expected. But
true.
Yeah, I want to know more about some researches.
This is the main basis of what we do, and I have to give him credit. So his last publication was a 15-year follow-up. So because
15 years.
15 years. So what they, and I need to describe the study to you because it's really quite remarkable.
So this is not such a young therapy. So not such a young.
Well, in the U.S., it's a little younger because of our you know, parameters here. You know,
in which country it started? In which
it was French. This particular study was French, and the doctor took patients that were already recommended to have a knee replacement. So they were already bone on bone or had very thin cartilage in the knee. So their orthopedic surgeon said, you need a knee replacement. And he went to these patients and said, wait a minute, would you like to join my study? You know, let's see if this works. If it doesn't, then you, of course, you can go have your knee replacement.
It's kind of a miracle when a person, when patient can regenerate their own bones. It's kind of
we have had this DNA and this ability a long time. It becomes dormant as we age, as we are exposed to chronic inflammatory changes, as we degenerate. And that's the whole process of sort of, you know, reigniting that fire in our youthful stem cells, and we can improve the production of the cartilage proteins and proteoglycans and other biochemicals that create these structural cartilages in our body. And that's exactly what the Hernaglow treatment did. And they published this first after, I think, 5 years, and then 10 years, and then 15 years. And the results were the vast majority of patients still at 15 years still did not need that knee replacement that they were offered 15 years earlier. So that's quite remarkable.
A vast majority, how many?
It was in
which number?
If it was the bone injection, it was in the 80% range. If it was, and they compared that to joint injection, which is in the 60-some% range. So what the study did not study was if at some point years later the cartilage degeneration came back, if they could treat again. It was a one-time. Yeah. So
one question. So from what it depends. Some patients have results, some not, some doesn't. So from what it depends, from their lifestyle.
Well,
so I think it supports a lot.
I think two things: the lifestyle. So if we do a regenerative procedure and your body is not in an anti-inflammatory lifestyle mode, or what we'll call an epigenetic, you know, pro health span mode.
Stress reduction, so stress of any kind, any mental, physical, like detoxification, all kinds of the stress.
And metabolic stress, Julia, too, not just all these things. All the mental stress, the psychological stress, the physical stress, the exposure to environmental toxins and poor diet and things, they all boil down to a cellular stress, right? And pro-oxidation.
Yeah, actually balance on cellular level is very hard to obtain. So we need to do so much stress reduction to obtain this harmony on our cellular level. And probably we can also use some frequency therapy for supporting this process.
Yeah, and there are many ways to achieve, you know, the improvement there. So if we do a regenerative treatment and you are not focusing on all the components of a health span, of an anti-aging, anti-inflammatory lifestyle, the result will not be as good or may not work. The other
if you are not true biohacker, even stem cell will not help you.
Well, they may help, but they may not help enough, or they may not help for as long, right? And that was one of your earlier questions: how long does it last? Depends on how bad it is going into it, which is the second component of how do you determine if it will work. We want to know how bad the tissue is. We want to know about how the bone marrow is. As we get older, we lose bone mass, we lose muscle mass. So all these things need to be supported in order to have that joint health and to restore the cartilage and to maintain the restoration. So if you have just partial life, if you're an athlete and you've had maybe a surgery, a small surgery
some traumas,
a trimming of the cartilage or something, then, you know, those clients tend to do better because they already have some cartilage and they already have a healthy younger body. If you are, you know, much older and you have no cartilage left, that may be a difficult case. Not that we wouldn't try.
How do you measure this cartilage?
We treat everyone individually, and listen, we've had good results with pain reduction even when we don't see the cartilage restoration because of the powerful anti-inflammatory effect and of the regenerative products, whether we use stem cells, exosomes, combinations of these things. Sometimes we see benefit immediately, and that's not because of the cartilage regrowth, because that takes months and months and months. We are seeing the anti-inflammatory effect, and a lot of pain, a big component of pain is inflammation. So if we can quiet down the inflammation, we can improve people's function, and they can walk more or exercise more, and that helps the joint too. So the steps are not just to regenerate the cartilage, they are also to reduce the inflammatory pain.
Does it mean that it reduces inflammation in our whole body? Because I believe all is interconnected, and we can have inflammation in our stomach, and at the same time we can have pain in our knee, and it can be connected. So does it mean that your therapy, stem cell therapy, helps to reduce this inflammation in all body?
Right, particularly if we deliver the regenerative products through IV, then it goes everywhere.
IV.
Now, if we do inject into a knee, the body does get some of that, but we call these spot treatments because we want to concentrate the results very locally. A bad knee, a problematic disc in the spine, something like that. Otherwise,
how do you choose this IV or some injection in some part of your body? So, or maybe you combine it.
Correct. So you just answered the question perfectly. We do combine them sometimes. Some people come in their middle age and they say, I've got aches and pains everywhere, but maybe I've got this really bad shoulder, right? So we will do an IV and try to quiet down as much as we can. If they come back and said, yeah, everything's feeling good, but the shoulder's still giving me trouble, it wasn't enough for the shoulder, then we could spot treat the shoulder. So sometimes we use IV just to kind of level the playing field and reduce the total body inflammation. And we have patients that come in for preventative IVs for anti-aging purposes, and really what they're doing is preventing the joints from degenerating. Or weekend athletes who want to stay fit, as we get a few years older, sometimes the activities we could do in our younger years they're at more risk for injury. And that's what we're trying to help prevent to the extent that we can through regenerative medicine, stem cells, exosomes, these kinds of things.
It actually sounds like a great solution for athletes who want to improve their results. So they can do better.
Now, these would, I don't know if you're actually competing, if these would be considered, you'd be disqualified for using these things, but...
Actually, yeah, interesting. Can they get disqualification if they use stem cell therapy? I didn't heard about this. I never heard such cases.
Right.
I never heard about such cases.
I don't know, but for most of us, weekend warriors and other athletes that just want to be able to keep going at the gym or go on a nice run and not worry so much about, what a 50-year-old knee can do compared to a 25-year-old knee. This might be a way to slow the process of accumulating chronic inflammation in the body, which is really slowing age. So we do have a group of patients, Julia, that we start before at the beginning who are interested. We do one of the biological or physiological age tests, and then we work with those patients. We do lifestyle changes, epigenetic modifications, and or the regenerative medicine, and then 6 or 12 months later, we will remeasure their biological age, and we're looking to be able to show the benefits, at least in some objective testing.
It sounds good. And I probably interrupted you a little bit. So the process, you said that you prepared them for treatment, and they can come in person. When they come in person, how long does it take? And the recovery, how long is the recovery after the treatment?
If we do an IV treatment, it takes, hour or so. And then the people can feel a difference right away. People with significant inflammatory conditions to begin with tend to have we call it stem cell flu. Basically, as their cells are flipped from a pro-inflammatory to an anti-inflammatory set of programming, there's a release of many of these stored inflammatory cytokines, which are small biomolecules that you might release during an allergic reaction. So they tend to feel funny for a few days, and some people don't. They just feel great, and they feel wonderful right away. It can last anywhere from weeks to months to even longer. So I personally have done IV treatments for myself, and I do it every few months just for that little boost and edge and slowing down of things in the aging process. And other patients who need a spot treatment, an injection, If it can be done in the office, if it's something superficial or a ligament or a tendon, just takes a few minutes. If it's something in the bone, we do like to do that at a local surgery center under sedation takes about 5 to 10 minutes, because we don't want them to have to feel that pain from the bone.
And they can go home.
Yeah,
right after.
You can go home. Unless you have a bad injury, you can actually begin using that body part, and we actually want some element of weight-bearing exercise, because the weight-bearing does stimulate the stem cells at the end plates of the bone, in the spine and in the joints. Same with yoga. We like flexibility training, like yin yoga, because that pulls and stretches on what are called the mechanoreceptors, which are the small cells and their receptors that sense certain movements, and certain movements stimulate the activity of stem cells in the body. So a combination of the things we can do for people through regenerative medicine, plus their own activities, can have a synergistic effect and really stimulate the process. And I always give the analogy, Julia, if you have young ones or you have nieces, nephews, children, a 3-year-old will fall down and skin his knee and cry, and then the mother will clean it, put a Band-Aid and kiss it, right? 3 days later, that Band-Aid comes off and the scab's almost completely healed, right? You're like, what? My goodness, it's almost gone. Whereas if you're 50 and you bump your elbow, you have a bruise for 3 weeks. So
absolutely.
So it's the same body, it's the same DNA. Why does it not heal like it was when it was 3? And it can. It just needs a reminder and a reprogramming through regenerative medicine and epigenetic lifestyle modifications.
To be clear, when we talk about injections, we are talking about injection of stem cells that you get from the person, from the patient.
No, I'm not happy with what's called autologous harvest. So first, stem cells are one item. The other item would be exosomes, and I can make a brief explanation.
Please. I wanted to understand, is this something natural,
sure,
or there is some synthetic compounds as well?
Sure. So we do not harvest from the patient. The bone harvest is painful, and the fat harvest, I don't like the fat stem cells because fat and obese tissue is inflamed, and I don't want stem cells who are pro-inflammatory programming. I want so plus, if you take from ourselves, we have aging and dormant and sleepy stem cells. I want the most youthful stem cells, like that 3-year-old who can heal his knee in 3 days.
Oh my God, so now something new for me. Actually, to be honest with you, I thought that it's only, we only are going to use the person's stem cells, but now something interesting coming up.
Yeah. No, there are many clinics that still use autologous. It's just, I think it's not as effective. And they get good results, it works, but I think even better, you want the most youthful source. So we purchase both stem cells and exosome products from reputable labs who have FDA cleared labs. Now, of course, the procedures are not approved by the FDA. They're also not unapproved. They're just not yet fully evaluated, and that will be a long and slow process because of the outside forces. But these are from perinatal sources, meaning they are screened and selected mothers with planned cesarean sections or C-sections, and those C-section mothers deliver their babies. They're happy, and then these companies take the amniotic fluid and the placenta and the umbilical cord, just like described in Tony Robbins' book, Life Force. And these products, which were previously considered medical waste, they were trash, are now kept sterile. They are processed, they are concentrated, they are filtered. They are not modified. However, it's the same, natural tissue. It cannot be modified. And those, and they're tested for various, diseases and what have you. And then those are made available.
So all those natural compounds, nothing synthetic?
Nothing synthetic. No, this is all completely natural from perinatal sources. And some people ask about the ethics of that. And these are, mothers in the United States who are having planned children. This is not something, crazy or for the purpose of harvesting. And so these are completely ethical. They're done right. And then on top of that, people worry, am I going to reject this foreign tissue? And one of the beauties of stem cells and exosomes is they are immunoprivileged. They modify or modulate the immune system in a way to not have that immune reaction. So we have not seen any problems from that whatsoever. So I'm very pleased with these products. We do obtain them from different companies in the United States, and we keep them here. I have a special freezer. They're shipped on dry ice, and we stock them. And that's the most expensive component of the procedures. We have to buy these biologics.
Mm-hmm. We have one question here. What about a case like RA in fingers with some damage?
Yeah, so a couple of different things for RA. RA is a systemic form of arthritis. It's a genetic disease, and there are different levels or forms. It depends on, if you developed it as a child, maybe you have both of your chromosomes have the problem or just one, and it becomes a problem later in life. And it really is a diffuse body hyper inflammation condition. So patients like this, I like to start with IV, and IV is usually quite effective. These patients tend to have a day or two of what we call the stem cell flu. That benefit can last for weeks to months at a time, depending on how bad. If we're talking about the deformity of the fingers because it's prolonged and there are certain pains, those fingers can be injected also. But I would start with the IV because that may take care of much of it. And then the joints can then be addressed one at a time or all at the same time, but separately. Those are spot treatments.
What is interesting, does it help only for those conditions which didn't cause by genetic and like genetic predisposition and stress from external internal environment? This is the cause of any disease. So genetic predisposition and our exposure to stressors from environment inside or outside us. So when we're talking about this treatment, does it help for those conditions which was not caused by genetic predisposition, or it also helps for those conditions which are caused by genetic changes in genetic?
No, listen. Rheumatoid arthritis that we just talked about is a genetic form of inflammation system gone haywire.
Just before we talked about some traumas, some anti-aging effect,
right.
Anti-inflammation effects, regenerating. It's like potentially anybody can regenerate itself, but the question is how fast and how easy it's to do for the body. Now we started to talk about some genetic cause of some.
No, I understand. Mm-hmm. So again, it flows into the pathway of what's causing the inflammation, whether it's genetic or environmental or infectious, like Lyme's disease. It is an infection that is an overactive inflammation system. This syndrome of fibromyalgia is an overinflamed, muscle, ligament, tendon inflammation system. Some of these things may have genetic, predisposition, but rheumatoid arthritis is a pure genetic hyperinflamed system. So the benefits are no different from these approaches, from the stem cells and the exosomes.
So different effect.
Right. They all serve to reduce the accumulated chronic inflammation, because we are not aging, we are inflammaging, right? How much inflammation we are exposed to. I did not invent that term, I just love it. But how much inflammation we are exposed to and we accumulate is really how fast we are aging on a biological or physiological level.
Gotcha, sounds great, and I want to remind our community or let them know, if they don't know yet, that there is some special deals for our Biohacking Congress community. If you reach out to us, or you can check the section Top Biohacks at our website, or you probably can reach out to ReCELLebrate and say that you are from Biohacking community and get some special deals. And of course, I want to know how much does it cost. So probably I should plan my next visit to ReCELLebrate in Los Angeles soon. I'm so excited by this opportunity. Listening to you sounds really exciting.
Well,
and as a true biohacker, I must try it. How much is it?
Well, for participants of the Biohacking Congress and those of us in the biohacking community, I love to meet you all, and I learn from all my different biohacking friends who self-experiment just like I do. So for anyone listening to this, anyone who's going to participate in the Austin event, and I welcome you to come. I'd like to meet you personally. I am going to have a booth. It's my first ever exhibit booth. We just got it in time, so we will be there, and we can answer questions and have get to know each other. For any of those people, I'm offering a free televideo consultation. It's the initial anti-aging, what don't you like about yourself, what do you want to do better visit. You can contact, I know the Biohacking Congress has put up a web page where you can contact us for that special deal now. You do not need to wait. We can do that even now, even though the Biohacking Congress is in February.
We actually have such a question here. How can we get in touch with you? So yeah, the easiest way, just contact ReCELLebrate Instagram page. I believe some people after watching this live and when I will post this, they will watch a recorded video and they can understand that. Please reach out to ReCELLebrate. I will tag ReCELLebrate in caption, and you can go and you can send your message, and so you will get answers.
That'd be great. I look forward to meeting more. Yeah, please follow us at ReCELLebrate, and we also have TikTok, and I answer some questions there. And
it's nice.
Yeah, I need the kids to show me how to use it, but I'm having fun with it. So thank you.
Yeah, it was a great conversation. I really learned a few very new things for me, which I have not heard before.
Great.
Yeah. Thank you for this. And again, join us in person in Austin. February 4th and 5th to the event, Saturday and Sunday. There will be 30 plus speakers, keynote speeches and panel discussions all 2 days from 9 a.m. till 7 p.m. and a big expo space with up to 30 selected health companies, devices, solutions for your health optimization and longevity, and ecological products. So take a chance to start your biohacking journey, or if you already do your biohacking, just join us to learn from the first hands from such a great experts as Jeffrey DeGross, founder and medical director at ReCELLebrate. And to reach out to ReCELLebrate to use this opportunity to live healthier, longer, and more happier, more active. Because now we all have access to this and all this work, and we should use this. Why don't use it? It's like obviously good for us. Thank you. And remember that not any magic pills or just magic device will help you. Also, you should follow your wellness protocol, healthy lifestyle on daily basis, and because not one magic pill will help you. It's all holistic approach. And measurements. Of course, we need to measure to understand what helps, what doesn't work. Yeah, Thank you. Thank you, Jeffrey.
Thank you, everybody.
Very interesting conversation.
See you in
Thank you for your
Austin.
time. See you in Austin. Yeah, bye-bye.